November is Lung Cancer Awareness Month, and my next guest is no stranger to the program. He's been on before, and it's Mr. Mark West, Facilitator, Lung Cancer Thoracic Malignancy Unit, Eric Williams Medical Sciences Complex. Good morning, sir, and welcome back.
Good morning, Lisa, and thank you for having me.
Wonderful. So we're talking about lung cancer, which I want us to start off by putting it in pecking order of the various cancers that we're seeing in terms of deaths occurring here in Trinidad and Tobago. Where does lung cancer fall?
Well, thanks for that question. It's a very, very important question. I'll give you a background perspective in a little while, but to answer your question, lung cancer specifically is number 4.
Right.
Number 1 is prostate cancer.
Okay.
Number 2, coming up very close, is breast cancer. Number 3 is colorectal cancer.
Right.
And number 4, lung. And number 5 is cervical cancer or ovarian. Yes.
Okay.
But it is a very troublesome situation we have in Trinidad and Tobago. There are collectively a large number of people who suffer from this.
Right.
Increasingly, we're seeing amongst a lot of pancreatic cancer as well. So cancers, unfortunately, seem to be on the rise. And we know in the case of lung cancer, the main cause of that is tobacco consumption.
Right.
Either cigarettes, cigars, or pipe, or increasingly secondhand smoke.
I was going to ask you about secondhand smoke and how does that contribute to lung cancer as well? You know, you have no control over that really, except to walk away or to ask persons to leave your presence.
Correct.
Yeah.
So we are fortunate in this country. The Parliament acted. We have legislation that bans smoking in public places, so people must step outside to do that. It's worldwide. People are becoming more recognized for that.
Yeah.
And so you will see smokers, quite rightly, away from the majority of people, but it still is a risk. And in our lung cancer unit, we know that approximately 70% of all our cancers can be directly attributable to smoking. However, there's a worrying 30% which we don't know why. And we're seeing this increasing, particularly among females.
Yes, among females.
Yes,
that's very
among
interesting.
females. So we have instituted an education process throughout the country. We visit many areas discussing the signs and symptoms and what to do. We'll come to that shortly. But also, we focus on this increasing amount of cancers that we're seeing. And we're looking at educating our young population, our children.
As a matter of fact, are you finding lung cancer in what demographic? Younger? You said 30% female, but
Right.
what about age group now?
Right, so the median age or the middle age is still between about 50 to 60 years old. So that fits with the rest of the world picture, which I suppose in a sense is comforting. We're not seeing it in the extreme youth, although unfortunately there are all these examples. I had a 16-year-old who had lung cancer last year, who unfortunately, of course, demised.
Yeah.
Hi, Kerry, good morning.
So there's been a relatively new trend of vaping. Has there been any evidence thus far to link vaping to lung cancer or other related cancers?
Right. So to answer your question specifically, there is no specific evidence. This is because it takes time to properly accurately accrue the evidence. You can't throw this information out and accuse vaping of doing that without specific evidence. But we do know, and I have been warning, the only thing that you should put in your lungs is fresh air. However, people like to think about vaping, and there are a large number of body of evidence that vaping is dangerous for lung health. And it's sometimes to do with the kind of flavorings they put in, but there's another background thing coming. And I read an article just recently about somebody who had to have lung transplantation because of secondary to vaping. So vaping, in my view, and it's a personal opinion, is a dangerous process.
What about the symptoms of lung cancer? How can you identify, maybe I need to be checked, I need to get myself tested?
Right. So the most common symptom we find is a cough, which of course is very common among many of us. We get flus, we have various sinus problems, we cough. But what we should be focusing on is a cough which goes beyond 3 weeks. This is international data, and once you have a cough that's persistent beyond 3 weeks, you should visit your doctor. The usual first investigation, aside from a clinical examination, is a chest x-ray.
Okay.
And if the doctor thinks it's needed, he would do or organize a CT scan, and then it goes from there. And this is where our lung cancer unit has come into being. I found that there has not been a synchronized, organized way of investigating and treating all these patients. So when I returned to Trinidad, I developed this lung cancer unit,
Right.
which now functions rather smoothly. So once a patient is presented and we advertise openly to our general practitioners, if they have any concerns, their phone numbers, you can call straight in, come straight into us. We see the patient very quickly, and then if necessary, organize a CT scan and then a biopsy.
And what happens next? Once you discover you have lung cancer, what's the road to, is there a road to recovery, or is it just taking care of your life until
Your demise. Well, unfortunately, a large number of our cancers present late. People don't go for the chest X-ray. They smoke and they cough and they think it's just a normal cough. So what happens is we decide on how, if you like, how bad the cancer is. We stage the cancer. This is an international process. Staging goes from stage 1 to stage 4, stage 1 being the best, stage 4 being the worst. Majority of our cancers in Trinidad and Tobago are stage 3 and 4.
Right.
If you're at early stage, you may have surgery, which is life-changing and curative. However, in the later stages, 3 and 4, then surgery doesn't often benefit. However, the good news is...
I like good news.
Yes.
Yes.
Medical science is advancing very rapidly. We are now into the era of what we call immunotherapy and specific biological markers. We have found that, and the person who found this got the Nobel Prize for Medicine this year, that cancers actually reduce, shut off, or significantly affect the immune system when they get into the body. And now companies are producing medications to fight that. And we found increasing survival. Now, it's clearly better not to have the cancer and get it at an early stage, which is what this is all about. While the good news is that late-stage cancers, survivals are increasing because of immunotherapy, it's most important to prevent.
Okay.
So in the case of cigarettes and tobacco, which cause lung cancer, we're trying to reduce that by educating our young people in schools. And we run a national school poster competition for World No Tobacco Day.
Right.
That's done in around February, March every year, and we're going to be doing it again.
We'll come back and talk about that
We
around
can come
that
back.
time.
We do that
But
then.
right now, before we go, I know there's something very special happening today, the 15th of November. Tell us
Yes.
about it.
So in recognition for World for Lung Cancer, and this is November, we host a fair, a health fair, based around lung cancer, but involving other areas of health, such as diabetes, hypertension. And this is based at the Eric Williams Medical Sciences Complex. It is open to the general public. People can come down and get information and interact with the entire team. Unfortunately, most of the team are busy working on this. I am only the one of the team, but we have 3 fantastic lung cancer nurses, administrators. So we have a full unit and many other support staff who will be there to help and answer questions about anything related to lung cancer and health-related issues.
Wonderful. Thank you very much, Mr. Marquez. Always a pleasure to have you on the
thank you, Lisa.
program. And continue doing the work. And we keep in touch with you, especially around February for that poster competition with the young
I'm
people.
very happy to come on and show some of the competition winners from the, we have all these beautiful pictures that have been made by our children, and we advertise that, and we want to bring it on. In fact, the ambition is to go regionally and then further.
Wonderful.
And we're talking to our regional partners about that.
And we'll help you whatever way we can.
Thank you.
All right. Thank you.